Hello, I'm Dr. Andrew Martin, Chair of Pulmonary Medicine here at Deborah Heart and Lung Center on this cold but beautiful day. But I'd like to tell you about some of the exciting programs we have in our pulmonary department here at Deborah. Pulmonary medicine encompasses caring for patients both in and out of the hospital with acute and chronic pulmonary problems such as pneumonia, asthma, COPD, pulmonary embolism, pulmonary fibrosis, and other illnesses. One of the unique things about Deborah Heart and Lung Center is the ability for a patient to come into the center and have their testing and therapy and evaluation be done on the same day. Patients can come in on a single day and be tested for lung disease, have x-rays, and have them interpreted by their physician in clinic on the same day. We run a comprehensive sleep disorders center with a full-service sleep laboratory and sleep clinic, a balance center, and a pulmonary rehabilitation program. One of my particular interests is asthma, and at Deborah we do a new procedure for severe asthma called bronchial thermoplasty. Bronchial thermoplasty is the first single procedure for asthma that reduces both exacerbations and emergency room visits in patients with severe asthma. Patients who are good candidates for bronchial thermoplasty are patients who are not well controlled with their asthma using aggressive medical therapy and still have emergency room visits or hospitalizations, or need to take prednisone more than once a year. A catheter is introduced into the small airways, and using 10-second pulses of radio frequency, the airway is warmed. This results over time in a reduction of the amount of muscle around the airway. The procedure itself takes 3 bronchoscopies. We treat one lower lobe first, then the other lower lobe, and the third procedure is for both upper lobes. This pulmonary rehab center is named after Dr. Gregory Olson and Dr. David Murphy, my predecessor as chairman of Pulmonary. Dr. Olson is a scientist who wanted to go up to the International Space Station, but because of a history of emphysema, he was deemed medically unfit. After a careful evaluation of his pulmonary function, Dr. Murphy helped Dr. Olson become medically fit, and he achieved his dream of going to the International Space Station. Through a generous donation by Dr. Olson, we were able to acquire the technology for endobronchial ultrasound. Endobronchial ultrasound can be performed either as part of a staged approach to surgery in the operating room or in the surgical ICU. Lymph nodes in the middle of the chest and the lung can be sampled non-invasively through a bronchoscope for the diagnosis of known or suspected lung cancer and other diseases. The lymph nodes are sampled and then immediately analyzed by a pathologist. This minimizes the length of the procedure and maximizes the chances of making a useful diagnosis. One of the new exciting programs here at Deborah Heart and Lung Center is our Multidisciplinary Oncology program. Patients in this clinic are evaluated by a team of thoracic surgeons, oncologists, and pulmonologists. My partner, Dr. Navdeep Brar, who joined us 2 years ago, is our pulmonologist in that clinic. Patients are seen for known or suspected lung cancer. This clinic meets once a week with those 3 specialties in addition to radiology and pathology. In this way, a patient is evaluated in a comprehensive way, and an approach to care that's individualized and comprehensive can be planned. 3 of the programs in our pulmonary department are the Pulmonary Rehabilitation Program, the Sleep Disorders Center, and the Balance Center. The medical director of these 3 programs is my partner, Dr. Michael Nolito.
The Institute for Sleep Medicine is a facility here at Deborah where we help people with all sorts of sleep disorders, ranging from excessively sleepy during the day, patients who are having difficulty sleeping like insomnia, and patients who have things like abnormal movements when they sleep. One of our employees, Tony Knight, who does a good job here at Deborah, has benefited a lot from the sleep program here.
I got into it because my nephrologist, my kidney doctor, recommended that I try it to manage my hypertension, which despite using 6 medications, my blood pressure was still running 190s, 170s, 190s. Since I've been on the CPAP or BiPAP machine, my pressure's running like 110, 120. They've got me off one of the medications, and it's been amazing how much more energy that I have compared to before. I didn't realize I wasn't really getting a good night's sleep. I noticed a benefit in how I felt within the first week. I felt amazing energy, And then my blood pressure started coming down really quickly, which I'm very pleased with. So they've got me off of one medication. I'm hoping to get off of more, but it's preventing any kind of problem with like heart damage. And Dr. Salitro, my nephrologist, told me that when I stopped breathing, my oxygen level went down to 70%, which is very harmful. You know, it's heart damage and restlessness. And I feel fantastic now. So I highly recommend it to everybody. If you have an issue, you know, do it. And I also have to give a tip of my hat to my wife, because she was right about my sleep apnea. She said that I was having episodes. Of course, I didn't believe her. She said I snored, and I didn't believe her. And I told her, I said, why don't you just take your phone and film me and show me, and I would have believed you sooner. But if your wife tells you that, or your partner, listen to them, because they're probably right. And it doesn't hurt to get it checked out, because the benefit can be very, very dramatic.
As far as the pulmonary rehab facility here is concerned, we take patients with underlying lung disease and we help them improve their quality of life. We do that by a tailored, comprehensive exercise program where we're able to increase what they can do on a day-to-day basis given the amount of lung function that they have. And this is of course done in addition to the medications that they need to be taking and the advice that the physician will otherwise be giving them. The Balance program, this is a program here at Deborah where we help patients who have difficulty with their balance. These are patients who are dizzy, patients who have vertigo, patients whose day-to-day lives are otherwise impaired by this problem. They are evaluated by myself here. We then will do comprehensive balance testing to try to find out exactly what the problem with the balance is. And then we go ahead and do a individualized balance solution here at the Balance Rehab program, with the net result being that they have a significant improvement in their quality of life, with sometimes near total resolution of their dizziness and balance problems, which they started out with.
As you know, about a year ago, Hurricane Sandy devastated the coast of New Jersey and some inland areas. As a result of that, Deborah has instituted a free screening program called the RESP program. Patients can be evaluated with pulmonary function tests. Patients who are both young and old have been referred to our clinics through the RESP program. We've seen a significant number of patients in our clinic that have been referred from the RESP program. Some of these patients have true lung disease. Some of them just need reassurance that they don't have dangerous lung disease as a result of exposure to harsh environments or mold. Fourth member of our pulmonary department is Dr. Martin Lansing. Dr. Lansing is an experienced pulmonologist and has been concentrating in his first months here on inpatient medicine and outpatient clinical medicine. We're very lucky to have Dr. Lansing with us. Deborah Heart and Lung Center also includes a full-service diagnostic pulmonary physiology laboratory. In this laboratory, we perform pulmonary function tests, tests of oxygenation, high-altitude simulation tests for people with lung disease who would like to fly, provocative studies for asthma, blood gases, bronchoscopies are all performed in this laboratory by a team of dedicated respiratory therapists and physicians. One of the most satisfying things about working at Deborah is that because of our proximity to the Joint Military Base, we have ample opportunity to serve our men and women in uniform. In addition to the nurses and nurses' aides that staff the clinics and the hospital floors, we rely heavily on our personnel in our pulmonary department, our secretary, Eileen Kozik, our nurse, Beverly Rokel, our manager and director of respiratory therapy, John Hill, and of course, all our respiratory therapists, both in the hospital and in our full-service pulmonary laboratory, and our therapists here in the Rehab Center. Deborah Heart and Lung Center is a truly unique institution. I would like to thank you on behalf of myself, our dedicated staff, and everyone who works here at Deborah Heart and Lung Center for your continued generous support.